If your care agency can provide domiciliary care in London, then listen up, because this tender is for the provision of domiciliary care services in the London Borough of Bromley. Not every tender is ideal for your business. Market engagement events help you to influence the council. Now, for those who don't know who I am, my name is Divine. I'm the founder of A Short Bid, and we exist to help health and social care agencies find and win tenders and contracts. Now, for many care agencies, this is a fantastic opportunity for many different reasons. However, one of the most important reasons you need to think about is that because this is a framework, and like a lot of frameworks, they're not going to reopen to allow new providers. In this case, Bromley are only going to run this for an initial period of 4 years, and they're going to commence it from August 2026, which means they'll keep it running till 2030. By keep it running, that simply means they're going to work with the already approved providers on the framework until 2030. However, the deadline here is fast approaching. Now, once the deadline closes, if you qualify for the tender, you meet the criteria, and you're successful in joining the framework, it essentially means that you've now given your agency a sustainable, not guaranteed, but essentially a very highly likely path to how you can gain and generate consistent income, because you can now deliver your service consistently because you are one of the providers on this framework, meaning that you essentially separated yourself from any other providers next year, 2 years, 3 years, or the 4th year, because on this framework, they may or they may not, but commonly they do not reopen it for new providers. So again, if you meet the criteria, you've got the requirements, you need to consider bidding for this opportunity. On this video, I'm going to break down some of the criteria and the requirements you need to know before you bid. And at the end of this video, I'm going to tell you exactly how you can go ahead and bid for the opportunity, depending on when you're watching this. However, first, a few things to note about the opportunity. Number one, this tender has been split into 3 lots. Lot 1 is specifically for Tier 1 patch providers. Now, bear in mind that the patches essentially are the regions within Bromley. So this is Central Bromley, East Bromley, West Bromley, and South Bromley. Lot 2 is where you'd be working specifically with adults and potentially older people as well, so over the age of 18 and onwards. And Lot 3 is specifically for providers who can work with children and young people. Now, pricing is also something you need to consider, because currently they also have a pricing ceiling, so a rate ceiling, which varies depending on the age group, but also the complexity of care, so the level of care required for the individual. However, most importantly, we need to know exactly what the requirements are. So I'm going to cover some of these. I'm going to break it down into 4 different sections. We're going to cover the regulatory requirements, then we're going to cover the technical ability requirements, also going to cover the economical and financial standing requirements, and then also the supporting documentations that you might need to be successful in your bid. So in terms of the regulatory requirements, first of all, you do need to have a CQC registration. So your agency needs to be registered with the Care Quality Commission, but not just that, because this is an all-inclusive framework for both children, adults, and elderly people. You need to have the appropriate band. If you're bidding for Tier 1, you need to be both registered for children and adults as well, so both age groups. If you're bidding for the adult or elderly people, also ensure that your agency has a CQC registration to support that particular age group. Secondly, your agency needs to be registered with CQC within or in Camden. So within would be any of the neighbouring boroughs, which would include Sevenoaks, Dartford, Tonbridge, Greenwich, Lewisham, Croydon, Bexley, the list goes on. Thirdly, that CQC registration needs to have a CQC rating attached to it, and that rating needs to be at least good. So not requires improvements and definitely not inadequate. Technical ability requirements. Now, this is one of the most, if not the most important sections in a lot of bids. It is no different than this one, because this is essentially where you now need to demonstrate and evidence your experience, knowledge, capacity in delivering domiciliary care services. Now, in this particular section, you need to consider a few things: your use of electronic core monitoring systems, your quality assurance processes, and actually how you deliver outcome-based support. So what is your capacity in delivering outcome-based support and care? One thing you need to consider thinking about from now, and you need to ensure that you try your best to use, is contract examples or references, because they will always ask that, and they do ask that. So references being who else, so what other local authority have you worked with to provide domiciliary care services for that particular service user band you're bidding for, so for children and young people or for older people and adults. It could be the local authority, it could also be the ICB, could be the CHC, it could even be a private client. But irrespective of that, even if you haven't done so before, this is always, and there is always an opportunity to demonstrate in writing why and how you can still provide the services. But again, the main point here is that you need to spend a lot of time and focus here thinking about how you're going to demonstrate and evidence this experience, because it's one thing to deliver high quality care in person, and another thing to write and talk about it. In terms of the additional information and some of the supporting documentation you will need to be considering, a lot of it is to do with the staff and the training around the organization. So for example, the relevant staff should have NVQ qualifications. Your agency should also have an up-to-date training matrix to showcase and demonstrate that your staff have covered the mandatory training. So the training should cover significant areas for this tender. So areas such as safeguarding, MCA, medication, manual handling, the list goes on. So you should have up-to-date training matrix, and your staff should have completed these trainings because they're mandatory. As well as that, the council here, so London Borough of Bromley, on this tender do have a preference for agencies that are utilising the Oliver McGowan training specifically for LD and autism, so learning disabilities and autism. If you're working with children and young people, you should have the enhanced training, so your staff should have enhanced training. Now, for some of the other documentations, especially considering the policies, your policies need to be up to date, and especially they need to be tailored to the specifications regarding CQC and also the service user bands you're bidding for. So these policies should be all inclusive, but especially covering areas such as safeguarding, health and safety, your equality and diversity, data management, GDPR, the list goes on. So make sure that your policies are not the reason that your bid fails. So at this point, you should know if this is a bid or no bid, because we've covered the regulatory requirements, we've covered the technical ability requirements, we've also talked about the economic and financial standing thresholds, and some of the additional information and supporting documentations that your agency should ideally have. So based on these, you should have been given a nudge in the right direction of if you should bid or not bid, if you qualify or don't qualify. However, like I said, if you're on a point of qualify, this is simply a nudge, because this is not the entirety of the requirements. So you still need to ensure you conduct proper due diligence. So go through the tender files in detail to make sure you leave no stone unturned. And you can bid for the tender if after that you still ensure that you qualify by simply clicking the link in the description of this video. It will take you to the portal, the bid suite portal, where you can then see the bid submission platform that the borough here are using. So where London Borough of Bromley are using to procure the services on this tender, and where you can submit your bid. On bid suite, you can also download the tender files instantly in a zip folder, where you can, again, like I said, go through the requirements and actually create responses, make your analysis, etc. But do not blindly bid without actually assessing the requirements and the criteria as well. If you're new to this channel, like I said, my name is Divine, the founder of A Short Bid. We are here to essentially help health and social agencies and businesses to find the relevant tenders and contracts and win those contracts. So if you provide any services within that category, just leave a comment. If it's domiciliary care, any healthcare services, supported living, supported accommodation, children's services, within any area in England and Wales, leave a comment and I'll be happy to do a video, find a tender there, and we can go through in more detail as well.